I've heard people talk about it like a Batman, like they call respiratory
Yeah,
whenever
yeah.
he hits the fan. They come in nice and cool, like Batman, all stealth, like they fix the thing, and then they're out because they have 20 other patients or however many
Right.
patients that they have to see. So, welcome to Breathe or Die. This episode is with the Respiratory Coach, also known as Joe Lewis, who has an amazing YouTube channel that I have been a student of and a watcher of as before I was in respiratory therapy school, but now definitely while I'm in respiratory therapy school trying to earn my license and my degree. So, welcome to the podcast, Joe. Will you give people just a short introduction of who you are?
Yeah, absolutely. First of all, thank you, Dani Mae, for having me here. I'm always excited to join podcasts, and now you have one, and I'm so excited to be here with you. So, thank you so much for the invitation. So, as you said, name is Joe Lewis, and been a registered respiratory therapist since 2001. So, time flies when you're having fun. And back in 2018, after I got into education, I ended up starting a YouTube channel really for my class, my students, just to help them. I was answering the same questions over and over and over. And I was like, I feel like there's a better way to do this. So that's when I started the Respiratory Coach YouTube channel. And then, of course, had no idea that I was approximately 20 months ahead of a respiratory driven pandemic. And so when the schools got flipped upside down, educators, we weren't prepared for it. Nobody was thinking about how do we teach virtually, how do we use videos more effectively. Like we just weren't ready for that. And so when we were forced into having to be ready for that, my channel, a little under 2 years old, had a little over 150 videos on it, and it just went crazy. And it came out of that and started traveling different conferences, just going out. My goal is always to motivate, inspire, and educate future respiratory therapists and current respiratory therapists. But I really love the students. I really love the interaction, the passion that students bring, and the fire they bring to want to be good, to want to be great, to want to learn is there when it inspired in appropriate ways. So, that's really my goal, is just realizing that I want to leave the field of respiratory therapy in a better place. Not that it was in a bad place, but no matter how good it is, I want to leave it in a better place for the future. And the honor we get to just take care of people when they don't know where their next breath is coming from is something that's, I didn't get it early on in my career, but I found it. I said, you know what? This person trusts me with their breathing. They don't even know me. Like, that's the craziest thing. It's like, I can't breathe and I need you to help. So it's such an honor to be that person, to help somebody with the most organic element of life, which is breathing. It's just really fun role to get to play.
So I have so many questions for you on respiratory education as well as like your own story and journey. But before we get there, what I find is so many people have no idea what a respiratory therapist is. Like I'll say that title and they're like, oh, what? Oh, you're going to nursing school. And I'm like, no, I'm not going to nursing school. So for the people who don't know what an RT is, or I've heard it called an RCP, respiratory care practitioner, what is a respiratory therapist? In your own words, but also why are we kind of medicine's best kept secret? Like, why do people not know what RTs do? Because listening to you hear how important the breath is, like, we're not living without it.
Right.
Why don't people know who RTs are? And what exactly is it?
Yeah. Yeah. That's a great question. It's funny because, I didn't know what it was when I got into it. I just stumbled on. I mean, RT found me. I didn't find RT. And when you hear that story over and over and over, where people are like, why'd you get into respiratory therapy? It's like, I didn't really have a reason. It found me, looking for something to do, love people. And they were like, what about respiratory therapy? I was like, I don't know. I don't even know what it is. So what a respiratory therapist is a trained healthcare provider in really the details of breathing, understanding that air goes in and air goes out, but there's so many different elements that happen in between the air going in and the air going out. So many small things that can be altered that can mess up that process of air in, air out. And then the exchanging of gas at the alveolar unit, like there's just so many details that people just, for whatever reason, we don't ever think about it. That's why nobody knows what an RT is, because majority of the people in the world never will have to think about a breath. And so, and I think that's one of the reasons why when you say respiratory therapist and you're like, oh, so you help people breathe. And I'm like, yeah. And they're like, so you give breathing treatments. And I'm like, yeah. and a lot more. When you think about, a lot of people refer to it as life support. We know it is mechanical ventilation. Somebody, you know, it's so simple because everybody thinks asthma and emphysema, asthma, emphysema, asthma, emphysema. Nobody knows, very few people actually know about cystic fibrosis. Very, very fewer than that know about bronchiectasis. Nobody ever thinks they're going to get stabbed in the chest and have a pneumothorax. Nobody thinks about the person in a car wreck who almost dies because of a traumatic brain injury, and they go on mechanical ventilation, and they just hear, think life support. They just see the sick patient. They don't see the intricacies of that machine, and somebody has to be an expert on it, and that's us. And that's, just it's so crazy. You can talk about it forever. Like, you say, okay, so you work with adults. Yeah, but what about the premature baby who's born, whose lungs are immature, and they need mechanical ventilation, and they need surfactant, and they need care and ventilatory support and oxygen therapy. And then the pediatric who gets croup or epiglottitis, and has asthma, and mama didn't know it until they brought 7 cats home, and now they're in the ED, and it's like, what's going on here? And then they realize, oh, they're allergic to cats. You know, the child who has, goes in anaphylactic shock because of a shrimp or a shellfish allergy. We play a role in all of those. And because, like you said a minute ago, if you don't know how important it is breathing, just try not, and
And
you'll find real soon, the importance of it. The reason we're so oftentimes either unknown or misunderstood. I think there's a lot of things I kind of touched on it earlier. Is I just don't think it's something that we commonly think about. Also, our profession is relatively young. When you think about nursing and how long nursing and docs and some of the other healthcare professions have been around, respiratory therapy, I mean, we're less than 100 years old. So, I mean, we started on the job back in the 40s, and here we are in 2020 and 1940s, and here we are in 2025. So we haven't even hit our 100-year mark yet. And so we're still a very relatively, in the grand scheme of things, a very young profession. And then on top of that, just a lack of exposure, a lack of, when everybody thinks healthcare, everybody thinks doctors and nurses. And that's fair. They've been around for a long time and they've earned that. But even when you go to, like, even if you go to TV, which where so many people are watching and so many people see the cool drama, the dramatic effects and all this, oh my gosh, that's what I want to do. You watch ER, you watch, I don't even know, 911 or whatever they all are, where you see paramedics in action. It's like if you ask a high schooler, like, I want to go into healthcare, what do you want to do? I want to be a cardiothoracic surgeon, or I want to be a nurse, or I want to be a flight paramedic. Like, I want to be a paramedic because they're in the spotlight. And they have been, and again, they've earned that right. And so for us, it's just bringing to light that the intricacies of what we do, which is why I talk so much when I talk at conferences. I talk about RTs, and this I think is the number one reason why RTs are little is known about us or unknown altogether. Is we don't we don't take the opportunity to talk about what we do enough. But we don't talk about the intricacies of the things we know. So the misperception, like all we do is give breathing treatments, is such a short-sighted view of respiratory therapy. But we all got to be out there screaming at the top of our lungs what it is that we do. We have to get more active in health fairs at the high school level and community activities, and just involved with the public. Find reasons to put media releases out there, and take opportunities to get on a news channel. I mean, During Care Week was 2 weeks ago, and how many respiratory therapists did you see on TV other
yeah.
than yourself? But I think that's what it comes down to, is just our own profession taking the opportunity to shout from the mountaintops who we are and what we do. And it's a lot. It's complex. You go to other countries, they don't even have respiratory therapists. So there's that. So it's just, this is learning. We're kind of new kids on the block, but you know, you'll know. They'll know. If you don't know who we are now, just wait. They will.
So that's something I'm really excited to highlight just a little more, because what I have learned, because I'm still in school, obviously I have 9 months to go until I
There you go.
graduate. But I had been teaching breathing techniques for a long time, really going down breath education as a whole. So anything that had to do with breath, I was trying to learn. And that's how I found out about respiratory therapy. But even then, even though I felt like I had done my due diligence to educate myself and investigate, it wasn't until I started clinicals and I'm in the hospital and I'm at the bedside, I'm with the RT department, that I realized whoa, like this profession is so much more than I could have ever known or anticipated. And you hit on so many things where, like, when I try to okay, so you also said something about different shows, so I wanna highlight a couple things. The first is that show, The Pitt on HBO,
Yep.
that's coming out as another season in January. I was watching it, and everybody was getting praised for how lifelike it was, how realistic it was of, the ED, the ER, the health system as a whole. But I'm watching it, I heard them call for respiratory once, and then as I'm watching it with my partner, I'm like, "Oh, that's what the RT does. Oh, no, that's what the RT does. Oh, if that's the RT, that would be doing that, but the doctor is doing it." So
Right.
you don't see respiratory therapists actually within the shows or represented in these TV shows, and I heard that the main actor, Noah Wiley, was like, "Hey, we got your feedback, RTs. We hear you. We're
Yeah.
we're gonna change that into hopefully the actual representation of RTs in the show." But the other thing I heard you say was like flight, ER, ICU, regular floors for breathing treatments. The RT is everywhere in the hospital. Like, I
Right.
didn't realize that, you have your ICU nurse, you have your ER nurse, you have your CVI nurse, you have your pulmonary flare nurse, you have all these specialties within nursing, within physicians, and all different types of care. But the respiratory therapist legitimately is on every single floor, in every single unit, in every
Yep.
department, and they're everywhere. But
Yep.
yet we have to be the ones that are calm, cool, and collected. And we come in, it's kind of like I've heard people talk about it like a Batman, like they call respiratory when
Yeah. Yeah.
everything hits the fan. They come in nice and cool, like Batman, all stealth, like they fix the thing, and then they're out because they have 20 other patients or however many
Right.
patients that they have to see. So can you just talk a little bit more to that? Because I think respiratory is unique in the sense that, in a lot of my experience, and I don't have that much, we're not specializing just on one floor or in one unit, at least at the hospitals I've been at. Like, you're expected to be able to go into CVI, to go into the trauma, to go down to ER, to go up to the floor, all within the same shift and know, or maybe the next shift, maybe you're on one
Yeah.
floor for that day, but maybe you go the next day, you're in completely somewhere else. We have to be specialists in all different types of units.
Correct. Yeah. Respiratory therapy really transcends all populations and environments in healthcare. And you can find certain, like one of the jobs I had before I got into education, I was in a large hospital. It was about, at that time, I want to say it was about 850, 900 beds. I think now it's over 1,000. But I was on the trauma team. So I got the opportunity to work primarily ED and trauma ICU, which was nice. But there was a whole nother team that was dedicated to med surg, and a whole nother team that was related to cardiac, and then a whole nother team that was related to NICU, and a whole nother team for peds. And so, you see where in that environment, yeah, I was kind of more specialized in the trauma side of things, but and then you go to another hospital and they've got one ICU with 36 beds, and every single patient from every back. I mean, you could have a heart patient in room 1, a significant trauma in room 2, a head injury in room 3, and COVID and medicine and a surgery patient in 5 and 6, and you're taking care of all of them. You're like, whoa, you really do have to have the understanding of so much. I mean, it's a ton. It's not, that's what I'm trying to say. It's like, it's not just asthma and emphysema like everybody thinks so, right? It really is a lot. I fortunately have been lucky enough. I have never been one to I've never had to work in a NICU. So, there's opportunities. So I feel like the key here is that understanding that every place will be different. And if you're watching this and you're thinking to yourself, well, that doesn't sound fun to me. Trauma ICU doesn't sound fun to me. You can find something that doesn't include trauma ICU. There's so many jobs out there that if you don't like one aspect of it, then you find one where that aspect isn't a part of it. You know what I mean? If you love tracheostomies and that's like you love weaning long-term trach patients, then you should probably work in an LTAC. The thing is that every avenue in healthcare, there's an RT role for you. You just have to go find it. That's the thing. It's not about, oh, I don't want to do all of that. Well, you don't have to. You can find, and you can specialize in one arena. But the thing is no door is ever closed to you from specializing and getting the experience in everything, which I think is super cool. It's like, you get you spend 35, 40 years in the field and you're like, I think I think I'm getting tired of running all over this hospital. Then go work in a pulmonary function lab, you know? And then if you're like, you know what? Weekends, holidays, 12-hour shifts, night shift, not so much for me. Well, maybe you can go into home health. Like it's so much. There's no, if you think about a patient in healthcare, there's a job for you. There's a place for you. Even yourself, the first time we met, you were talking about your interest in research. Like that's a job in itself. When you think about telehealth, there's a job for you. So it's just super cool that it's so diverse. And I think Dana Evans hit on this when we during the shift. She hit on this and she was talking about how diverse it is. You should never get bored. And as a matter of fact, I'd say this real quick story. I got bored working. It was about I'd been in the field for about 8 years. I had been doing trauma ICU the entire time. And when I was a trauma junkie and ICU every single day, 36, 48 hours a week. And I drove home one day and I was like, man, I don't think this is what I signed up for. Like, I don't think this is, I was missing something, right? Some people say I was burnout. I don't know if I was burnout or not. I was complacent. I wasn't challenging myself. And I drove home and cried all the way home. True story. Because I was like, it was something in my soul that was missing. I was like, I get the opportunity to help people breathe, but I'm not feeling it like in my role. And I loved trauma and I loved the emergency department. That very next day, I went back into work and I said, I want off the trauma team. I want to go to another team. And they were like, perfect. We need help in med surge. And I was like, cool, that's exactly where I want to go. And they said, good, because we need an ICU therapist in med surge. And I said, I don't want to go to the ICU. I want to go to the floor. I want to go talk to people. I want to go talk to patients. I want to go deal with that COPDer who's embarrassed to wear a nasal cannula because she thinks she's going to be looked at funny or he thinks he's going to be looked at funny. And I want to have a conversation with that person, say, listen, this isn't the end. You've got more time. You don't get that in ICU. When you're in ICU, most of your patients are non-communicative until they get ready to leave the ICU. So I was missing that human element of it. And I think that's the point that I'm trying to make here is that if you find yourself stuck or like, I don't know if this is for me anymore, we have so many avenues to find your happiness. And that was the best decision I ever made because that's what brought me back to the human element of respiratory therapy in loving the people.
Oh,
And it brought it all back to me. And I thought I would never work the floor. I thought I was ICU till the day I died.
mhm.
And I ended up falling in love with human interaction by getting to talk to some of these sick people who are just scared. They're so scared because it's hard for them to breathe. And I can't I can't relate to that because I've never had a hard time breathing, which is why it's important for us to keep that in mind that we can't relate to them. So that's why we have to listen to them.
I also think that that's one of the main reasons we are kind of like medicine's best kept secret in those shadows because so many people, unfortunately, when they've gotten to that point where they can't breathe and they're going down the drain, so to speak, a lot of people don't make it. Like, and I've heard stories, I don't work in
Right.
COVID, and I've heard really traumatic stories from the RTs going through COVID of how many patients were lost.
Yep.
And I just want to highlight the fact that you can specialize in all different types of things in the sense of at TGH Tampa General down here in Florida, they have a trach team. So there's people, they go
Yep.
into work literally all day long, every day of their shift. All they do is handle trachs. You know, there's the transports on the helicopters or, you know, the like you said, LTAC, that's the long-term care. But also at one of the hospitals that I work at right now, they make you work the floors and the unit. So, like, if you're in the ER, you also have a regular floor. If you're in ICU, you also have floor. If you're in neuro, you also have a floor. And I had one of my CIs, my clinical instructors, say to me, people, a lot of students want to be in the action, right? They want to be in the trauma, they want to be in the ICU, they want to be in the ED, and that's where you know, that they feel like the big heavy decisions are made, the
Right.
biggest impact is made, but he said it's the floors because it's your assessment skills when you are in that floor giving grandma breathing treatment for her COPD and you can actually see, wait, I can keep her out of the ICU
Exactly.
because I'm noticing what's going on. Like having the skills across the board, I think is also something that is important to expose yourself to if you think, "Oh, I just wanna be I already know I wanna be a NICU nurse, like, I wanna be a pediatric,"
Yeah.
like, make sure you're also getting a little bit of exposure to other things because you never know what assessment skills you might need later on.
Yeah.
I don't know, I think, like people, once they start to experience the difficulty of the most natural thing in life, like we can do all these other things, or we need all these other things, but breathing is like the number one thing, right? Like as
Yeah,
soon as you can't breathe, that's where you're going to notice nothing else matters. Legitimately
right,
nothing else matters. And if and when you do feel that and you are able to come out the other side, I think there's a different appreciation to breath. And that's kind of where my expertise comes in, where I had started working with people who wanted to meditate or do yoga, or athletes who wanted peak performance, or CEOs who were like doing all these other, performance enhancing
right.
practices. And then they finally found the breath. But I'm curious from your perspective, where now we're working with people who have conditions, who aren't in their best state of health, and are working on their breath because they literally can't breathe. When you've watched so many machines breathe for people, is there something that you've learned, or something that you think you could share with people about the breath, like your perspective on breath itself and its
Yeah.
importance? Just like your normal, healthy, average person who may never see a ventilator or understand what that does, or isn't interested in breathing techniques, but like they're all breathing. Is there
Right.
something that you could say, like, here's what I've learned that you might want to pay attention to or know about your breath?
Yeah. So I think that's actually a really good question. I think all the years of working with mechanical ventilation, the biggest thing I've learned, thing I fell in love with was trying to optimize the vent for the patient instead of optimizing the patient for the vent, is realizing that it's just if we were to go outside right now and run around whatever building you're in, your house or wherever your office studio, wherever you are right now, if I was to go out and run around and come back, I would be winded. And I would say something like, hold on, I need to catch my breath, right? That is all from up here.
Okay.
It's all stemmed from up here. It's the neural drive to breathe. And that's what I am fascinated with in now 24 years into my career. I am fascinated with the neural drive because the brain is so weird because you have to do it. The diaphragm has to contract. So something has to be done. It's not like the heart. Because if you say the breathing is the most important, somebody goes, well, you can't live without a heart. No, you can't, but you don't have to do anything for your heart to beat. The diaphragm has to actually move. So without thinking about it throughout the day, we go. And so I have started just really paying attention to what my brain is telling me, like when I work out and when it says I need to catch my breath, I start realizing and I start tying that into how it feels to be sick. Because it's the same concept. We know that exercise can cause shortness of breath. So does hypoxemia causes shortness of breath, acidosis, shortness of breath. But from up here, it's the brain says, you better breathe faster, deeper, catch your breath. And I brought that made me a better respiratory therapist because I started looking at my patients on mechanical ventilation that were out of sync with the ventilator. You could tell they were in distress. It's like, if I say nasal flaring, this is something that if you know anything about respiratory therapy, if you have kids or seen somebody sick or something, the more distressed we get, the body does so many cool things to compensate for that. So one is the diaphragm contracts harder, so we can take a deeper breath, right? Also, we know if distress is enough, we can start to flare our nares, so the nares will start to open, right? And that's so we can bring in more flow, so we can get bigger volumes. You start to realize that, and I started looking and I realized that what those people are saying without saying a word to me, you can just look at it and you can say, I need to help. This is how I started thinking about it. I need to help this person catch their breath. Like that's it. Like the brain is saying, I need to catch my breath. And if you feel that, I mean, I remember running stairs in the hospital to, one code to the next and getting up to the top of the stairs and going, oh my gosh, I got to do compressions now and I got to catch my breath. That's what those patients are screaming out loud right there. And so what I would say to anybody who doesn't have pulmonary disorders, or even if you do, but you're not aware of your breathing, if you'll just start focusing on it a little bit, you will become aware of it and you'll start to see, how and what your neural drive, your brain, what your brain is saying, because that's what's driving everything. When your diaphragm is really sucking in hard to catch your breath, it's because the signal from your brain is stronger. That's why your diaphragm is contracting harder. If I could teach all these kids out here playing sports when they hit with a ball, or they get hurt, or they get hot, or they sometimes they think they're having an asthma attack, and sometimes they are having an asthma attack. If I could teach everybody to purse lip breathe, just take control of your breath, and just really focus on getting all that air out, because the truth is you can't get fresh air in if you can't get stale gas out. And so just little things like that that could really are tools and tips and tricks that we have in our bag, that it was always my I always just took so much pride in just being the one who's like, let me show you something, because you don't have to come to the ED every single time you get short of breath. Like, you realize that there's some things you can do at home. Sit down, take a break, use this breathing technique, and really teach pursed lip breathing, and get them realizing that, because asthmatics and for COPD patients, they think they can't get a breath in. Us as respiratory therapists, we know the reason they feel like that is because their lungs are already full. And so, yeah, you can't get a breath in, but that's because you didn't get the air out from the previous breaths. If they just knew that, and they could just pay attention, okay, let me focus not on breath in, but on breath out. Take some time, try to slow down. It's scary. It's scary, but if you can not panic and really take control of that, then I think you'd be able to, work through some of those times when you feel distressed, because we all get there. Like I said, it's exercising. You'll get short of breath. How do you work through that? I'm sure, you know, a marathon runners probably learn breathing techniques, just how your gait and your breath interact with each other, and lifting weights, and so many things. It's like, there's power in the breath. It's like if you'll coordinate those, if you're to try lifting weights and you try to breathe in the middle at the wrong time, it's like, well, I'm not as strong right now, but that breath helps you with your strength in the functions that you're trying to perform, the maneuvers you're trying to perform. So I don't know, I could talk forever about it. I don't even know if I answered the question, but I would say just pay attention to this up here, because this is where it all stems from.
Well, I think that's go ahead. I just think that's a really good segue into the education point, because the thing that I find, like, I came from teaching breathing techniques in like the yoga world. So a lot of people, what I would find other people who weren't into meditation, who weren't into sports performance or these kinds of things, but they were sick or they were coming off of a cold or something like that, and I wanted to give them a breathing technique to make them feel better, they would kind of say like, "Oh, that's woo woo. Like, I mean, I'm breathing all the time. I don't need to pay attention to my breath because it's doing it anyway." And my mission with my career is really to get research to show physicians, insurance companies, hospitals as a whole that these breathing techniques, you can actually prescribe them in the same way that you prescribe a breathing treatment of
Yeah,
albuterol or whatever else to make you breathe easier, are going to help you breathe easier, because the breath training is a prescription for the people who want to use it, because that's the big difference. They have to first and foremost pay attention to it and become aware of what their breath is doing. Then they have to learn the breathing technique taught appropriately and actually do it as an
right,
exercise. And I think that that's a big there's a couple of brick walls to get through, is first having people look at breathing techniques as legitimate, and then getting the people who raise their hand and say, "Okay, fine, I'll take the time to learn, I'll take the
right.
time to watch it, and then I'll actually do it." So in your experience with education, because I know you're within respiratory education and I'm
Yep.
in school right now, do you think that breath training, like as a prescription, because the only place I've ever seen it so far within respiratory care is in pulmonary rehabs. But I haven't really seen a lot of breath training or breathing technique coaching within a regular floor unit, or when somebody's coming out of the ICU. I only see them really do that within the pulmonary rehab. So, one, is that something that you do actually see on the floors regular outside of the rehab? And then two, do you think that that would actually create benefit? Like, I think it's going to create amazing benefits, but I'm curious,
Yeah.
as Marty, who's been on in the field for 24 years, like, do you really think that would make a difference?
I definitely think there's some subgroups or some subsets of patient populations that it would help significantly with. Yeah, so the answer is yes. Anything that optimizes breathing, I think, has a benefit and a potential to have enormous impacts on outcomes, whatever that outcome is from a measurable standpoint, right? So the answer is yes. I think it'd be really good. I think it all comes back to education, like you said. There's I think that's perhaps one of the greatest gaps in what we do as respiratory therapists. We do a lot of things, But if we could slow down just long enough to just all collectively educate the community more, I think we would see amazing outcomes. It blows my mind that in 2025, asthma is still the leading cause of childhood absenteeism in public schools. Like, what are you serious right now? Like in 2025, asthma is still the leading cause. Like that doesn't seem right to me. That right there tells you that there is a gap in knowledge from getting from what we have when we know what needs to be done to the home of the patients, that to understand the importance of it. You know what I mean? It just that seems really really odd to me every time I see that statistic, which also ends up being a labor burden because kids can't go to school. Where does mom and dad go? They're at home with the kid, right? So the economic factors on that from an education standpoint, and breathing techniques, not just adherence to medications, avoidance of triggers and all of that, but even just breathing techniques that you got that asthmatic who once again just gets into stress. If a mom had the knowledge to say, hold on, slow down. Remember pursed breathing? That, I mean, that alone in itself would probably, I think, and again, it goes back to what you said, the research that shows the data is what's missing from of the impact it could have. But without a doubt, something like that would be positively impactful on the community itself. And then not even it would benefit respiratory therapy also because it would probably put us in even more settings that we're not even at. I mean, you imagine a pulmonary clinic with like imagine every pulmonary clinic staffing full-time respiratory therapists, not to do pulmonary function tests, but actually educate on breathing techniques. Like imagine that. That's not something that currently is, I think, a standard, but it could be, and it probably should be because we're the ones with the knowledge.
Yeah, I've been going down the rabbit hole interviewing pulmonologists and like trying different RTs and all of the system as a whole and the way that it works and saying, and patients and saying, what do you think is going to work? What do you think is like making it not work so far? So I have big visions. I don't know how long it will take or if it will take, but I have really big visions of breathing because people, they might have heard of or diaphragmatic breathing, but there are so many breathing
Yeah,
techniques. Like it would blow your mind how many breathing techniques are out there and how you can change one breathing technique to become a lot of different ones just by
right.
altering or changing like the volume or the flow or the duration or the pressure or the speed, all these different kinds of things.
Yeah.
And so that's a discussion for a different day, but I'm just
I,
hearing you say that like makes me so stoked because I can see it. I just have to
yeah,
find the steps for other people to see it and find
right.
it and adopt it. So thank you for saying that because I'm like,
Yeah,
yes, I we need it and I hope it'll come out there and I hope RTs will get stoked on it as well because those are the people I think are more prepared and educated to do those jobs, to do that education and kind of keeping in line of education. I do want to mention the shift because
okay.
that was something I was lucky enough to partake in. And honestly, it was an opportunity to be educated as a student in ways that I was not anticipating. I didn't think I would learn as much as I did. And I want to hit on it because if you'll just tell people what the shift is, and then we'll dive into that a little bit because I really do think education as a whole is kind of stuck in um, a way of academia that doesn't really help RT students all the time the best, and I've been really challenged as a
Yeah,
student, so when I went on the shift and I experienced what you did, I was like, "Oh my gosh, people are teaching in ways that are so much better than
yeah.
I could have imagined that are out there." So, yeah, tell people about the shift.
Yeah, so The Shift is the first ever respiratory care reality show. We Season 1 is underway right now, so episode 3 aired last night. Our host here, Dani Mae, was one of the contestants on it, along with 5 other respiratory therapy students from across the country. And my vision for The Shift was I just wanted to do something fun, and it just felt like I've always been a kind of a reality show fan. I actually went on one back 2 summers ago, and I was like, I could do this. You realize that nothing is impossible if you can just get the right people around you. But the goal behind the shift was really just to highlight respiratory therapists and what we do specifically from a student perspective, because I know the creative genius that y'all have. Y'all are the future. Like I said, I just wanted a platform to be able to showcase you and Sarah and Kevin and Devin and Eric and did I forget somebody? Danny? No, I
Brandon.
got them all. Wait, who did I
Brandon?
forget?
right?
Brandon, sorry, Brandon. But, really just to show I feel like the world needs to see the brains that y'all have and the way y'all can work and the way y'all can work in stressful scenarios. One of the things when I was doing the shift, I never thought about what it was gonna be like for y'all. Like, I just thought, everybody was gonna come, and then when everybody started showing up, and then the judges came, so 6 contestants, 4 judges, 2 coaches. The judges and the coaches were RT professionals, with education background, research
Superstars
background.
in
The what?
RT, like superstars.
Yeah, yeah, yeah. Yeah, yeah. I tried to get people that, invest in their profession, and they were amazing. I never thought what it was gonna be like for y'all to put a microphone on, because I had been there before, so I wasn't concerned about it, but I was thinking, I was like, and I know you had your YouTube channel, so but I never thought about, like, just that moment, like, y'all get mic'd up, and it's like, how nerve-wracking that must have been for y'all, but then not only that, but then you had these superstar judges and coaches that were there, at times helping, at times judging. Like, how much pressure that must have been for y'all and how nervous it must have been. I never thought about that until afterwards. And then I was, going back and watching and cutting it up and in the post-production phase, and just never put it 2 and 2 together. But the purpose of the shift is to bring awareness to respiratory therapists or respiratory therapy. It was also, in my mind, kind of my gift to the RT community for Respiratory Care Week. Everybody always says, like, "Oh, there's no RTs in ER, the pit, and all that stuff." And I was like, you know what? There's not. But why can't we just make our own show? So it was kind of the way my idea. I was just like, let's just try it and see if it works. And if it works, fantastic. If it doesn't, fantastic. It doesn't matter, right? So stop waiting for somebody to put you on their show and just build your own is basically the thought process. The byproduct of what you said is very, very important because you picked up on it, and I hope other people are picking up on it. It's meant to be entertaining and educational for the future respiratory therapist. It's also meant to inspire current respiratory therapists to dive back into some of these things and find that passion that got them into it in the first place. But the secret behind it is to the educators watching to go, I never thought about doing that. I never thought about teaching outside of a lecture and a PowerPoint. And to go, holy moly, like there's that we could do that in our classroom. I mean, yeah, we had cameras and we put it out there and it's out there on YouTube and big production. But you could do it so easily without any cameras and just create these fun learning exercises in your classroom. And that's really what I hope comes out of it. The long-standing effects of it, is that I really do hope it somehow, very small, changes the landscape of education and the way we teach our students in the classroom.
I think it will, and I also am gonna get on a big soapbox and tell people as a student how much it influenced me because when I was hearing, like, Liz and Kat who were doing the escape rooms and had already been doing them, I had never done an escape room, and I still, to this day, remember, like, the patient presentation and all the different things that we had to figure out
Yeah.
to go through the steps of those escape rooms, and I remember, like, just stepping back being like, "Wow, other students are getting this in their education as a way to remember rather than just cramming," and that's another thing I'd like to hit on is you feel and obviously I know you're not in all the schools or anything like that, but do you feel that a lot of respiratory programs, education programs, are more focused on just passing the boards to get your license? Or do you think they're really trying to prepare you for the field itself? Because one thing I hear, and again, this might be a major overgeneralization, but what I've heard a lot is that the school is to prepare you to pass your boards, but your first year as an RT is like on the job training. You're going to learn more in that first year on the job than you could ever learn in 4 years of school. So, can you speak to that?
Yeah, I don't think that the majority of programs out there are just focused on passing the board exams. I think majority of educators I talk to really care deeply about you as an individual and wanting you to go out there and be a quality respiratory therapist that really impacts the patients you get to take care of. That what you described after that with take your boards, then get your job, and in that first year, you're gonna learn a lot. What I will caution against is, are you gonna learn a lot of right things? or are you about to be reprogrammed to do things incorrectly, to take shortcuts? Because that's this is my soapbox is at some point in time during orientation, you're probably going to hear somebody say like you're really smart, you're going to be a great respiratory therapist, but you need to work on your time management.
Oh my gosh, yes.
And what they're saying when they say that is you gotta move faster.
Mm,
You gotta move faster. You don't have 60 seconds to count an accurate respiratory rate. You don't if you're gonna count one at all. Like there it's gonna be this push to assimilate to the real world. And I think the biggest problem in respiratory therapy is that the board exams actually teach you over the fundamental correct theories of respiratory therapy. Those should not be reworked post that exam. It's not like, oh, I only needed that for my exam. And I'm case in point. I I had students in the clinical setting and I was teaching them the right way, the fundamental theories, apply it right now on this patient. Can you go through the motions without thinking about some of those things? 100%. And can you do things in shortcut manners and I don't want to say incorrectly, but not correctly, which is the same thing. But anyways, and then you go, oh yeah, I'm a real world therapist. The there's a gap between the test and the real world. There definitely is, but don't forget the test that test is testing your fundamental knowledge. You should never build that. It's like building a house on a strong foundation, and then one day going, I don't need to take care of my foundation. Doesn't work, does it?
yeah.
You got to build a strong foundation, and then you have to continue building on that strong foundation and making that foundation continually keeping it intact. And I think that's, where that message that you said, pass the test and then you'll learn how to be an RT. First of all, how frustrating for students is that? Like, come on, give me a break. Like, get out of here. Like, you go to clinicals and you go with a preceptor and it's like, hey, can you help me with this? I'm learning this in class. Can you help me understand this form? It's like I haven't used that since I was in school. Well, hold on, then why am I having to learn it? What how frustrating, right? And so we really need. And this is why I open all my videos with "What's up, future respiratory therapists?" because I really talk to the future and hope to inspire those that have watched me to continue to stay active. Like I've got people interact on my YouTube channel. They were students back 4 years ago, 5 years ago, 6 years ago when I started the channel, and they still tune in. They're still watching it. Those are the ones I'm proud of everybody, but those are the ones I'm the most proud of because they graduated, got through school, and they keep coming back for more and more and more information. Those are the futures. That's the future of respiratory therapy, and that's what we need when we talk about highlighting what we know and the intricacies of what we do and shouting it from a mountaintop. You got to know it. You got to remember it. If you want to show off and you want to be that expert at the bedside, then you got to be talking about the things that no one else talks about. And that comes from a strong foundation and not getting complacent early in your career by just doing things. This is how we do it in the real world.
I'd also like to shout out the old school therapists, the ones who've been doing this for 30 plus years, who when they see a student come into their hospital, they actually take the time to answer their questions, to get them excited because I've run through a couple of hospitals as a student and it's immediately clear what RTs don't want to be bothered, right? Because I'm an inquisitive mind and I ask a lot of
Yeah.
questions, so I can be pretty annoying, right? And some of these people are like, "Please don't ask me another question, leave me alone," and I respect that, but I think that, like, it's disheartening to a certain degree because if like you said, it's this new generation coming in. It's the future of RT. And when I get those therapists who legitimately have been doing it for almost as long as I've been alive, and they're super stoked and they're like, hey, come look at this. Or I ask a
Yeah.
question and they're like, great, now let's go down deeper, and they pull me through the thought process, whether it just be talking it out or legitimately like taking me into a patient's room or taking me into the supply room and like working it through. Those people have seen so much progression within respiratory care,
Yep.
and it lights me up to
Yeah.
see them get excited, to help me get excited. Those are the ones who have been MacGyvering things. That's one thing I keep hearing about respiratory therapists is
Yep.
they're MacGyvers. They used to have to do all these things that
Right.
now through innovation in different supplies or devices, have been, changed and bettered.
Yeah.
But like they understand how things work. They used to be tinkerers. So I just want to say if you're an RT and you're like an OG RT, give your students a little love, give that next generation a little love because the other thing I hear a lot is that like nurses eat their young, like nurses kind of give the nurse students a hard time, but like in my experience overall the RTs have been really welcoming, they've really
Yeah.
tried to like lift us up, but there have been those few where I'm like, "Man, you probably know so much more than I'll ever know and you don't want to talk about it and you don't want to share." And so it's nice when you get those people who really do want to educate.
Well, I think that's where we all need to realize, everybody, all RTs, that we're all educators. Like, you have to take that opportunity to invest in the future. That's just what it comes down to. You got to invest in the future. You invest in your own financial future.
Yeah.
You invest in you keep your car maintenance. You do all that stuff. Why? You're investing in the future. Same thing with our profession. See, I'm playing a game for 100-year game. I won't even see the end result of what I hope one day RT is, which is a little disheartening, but at the same time, not at all, because I know if you just keep laying the pathways and if you just inspire people. I tell students this all the time. I say, think about that day you went to clinic and you had that preceptor that you, as you said, maybe wasn't interested in teaching. And again, we don't know what's going on. We have no idea what's going on in anybody's lives. But for whatever reason, the perception is like, I'm a hindrance to them. I'm a burden to them today. How did you feel when you left that clinic? You probably called your school buddy and you were like, my day was terrible. Like the preceptor did not want to, were not interested in helping me. It wasn't a good day. I could have learned more if I'd have stayed at home. But I'll come back to that in a second. Versus that day you go and you get that RT that does take the time to invest in you and lift you up and help you and clarify things. How did you feel at the end of that day? And what did you say when you called your buddy? Today was amazing. I can't wait to go back. I hope I get Anthony again when I go back. Like, you have to realize as students, you yourself, within a year, that's going to be you. You're going to have a student. A year to 18 months, you're going to walk in one day and they're going to be like, "Hey, Dani Mae, today you got little Joey over here. He's a first year student." And that is your opportunity to impact how that phone call goes after class. That is your opportunity. And you just have to think to yourself, do you want people leaving your clinic going, "That was terrible. I hope I never get Dani Mae again."
Or
Like, you don't
even
want
leaving the
that.
profession. I've had a
No.
lot of students in my
Yeah.
class drop out of the profession, and I think
Yeah.
that but I guess that's probably one of my next questions is do you think there's a certain type of personality that is made to cut it in respiratory, or do you think that there is something in particular, either like of the student themselves or of the preceptors that will really influence somebody becoming a great RT, like a personality, a characteristic?
I mean, I can't say, I've taught so many different personalities throughout my time in education that I can't really say in terms of just making it as an RT. I can't really say that I see one personality, because I mean, there's so many different personalities. You got your extroverts and your introverts, and you know, and it's weird because you can take a significantly introverted person who you're like, how is this ever going to translate to the bedside, and how are you going to speak up during rounds? And then you find that they're amazing at the bedside. You're like, where did this come from? Like, what just happened here? Because I never saw that coming. And then you take that extrovert that you think is going to be amazing at the bedside, and they get to the bedside and they shut down, or they're not great at the bedside, or maybe they're too extroverted and they don't know, the boundaries of when to talk, more or less. You know what I mean? So it's so many elements to it. I think the number one thing is just caring. If you just care enough to invest in the people, whether it's the patients you're getting to take care of, or the nurse you're getting to work alongside of, or the student that you get to be a small part of their educational journey that day, if you would just take the time to be kind and caring and realize that probably not that long ago, you were in the same boat. That's the most amazing part, is that we graduate and how quickly we forget that I had a first day of clinic when I knew nothing. And so maybe more caring and less judgmental, I think, goes a long ways. So, giving the students the grace they need to allow them to grow, the space to make mistakes so that they can learn from them, the patience with the questions, so that they can ask those questions. That's what they're paying for. As an educator, I always reminded myself and my even my co-faculty members, there were times in a meeting where, you know, we're talking about this or that, and I would go, "Hey, don't forget, these are our customers. Like your student, if the students can leave here with one thing, don't ever let somebody tell you stop asking questions because what they're telling you is to stop learning. And you're going to learn forever. If I would have stopped, actually, that period I went through in time where I got complacent, I just didn't. It was because I had stopped learning. I just had fallen into the real world rut. And it wasn't until I came out and started diving back into the humanity of things and really going, what is that? What is that? What is that? What is that? And really, paying attention to the neural drive and how can I measure that and how can I assess that, really diving into it and then having a student with me and being like, come here, let me show you something. Let me tell you, you know how this person, how do I know this person right now is short of breath? Because I can measure their neural drive. Watch this, boom. And the student's like, that's so cool. And the students love, that's how I got into education actually, because I worked at a big hospital, students would come in and the clinical instructor would say, hey, can Joe, want to have a student today? And I was like, absolutely. And it got to the point to where the students started requesting to come with me because I enjoyed having them there with me. It was fun. It made the day more exciting. Like students have always lit my candle. So that's the enjoyment I get from it. Is just those elements when someone else fills your cup instead of feeling like you can just always keep your cup full on your own. That game doesn't work out very well for the long run. And so, but that's how I got the call for the interview to apply to the first educator position is that the students were requesting Joe Lewis all the time. We want to go with Joe. I want to go with Joe. So a position opened up. Who are they going to go to? The guy who all the students want to go with, right? So, and that's not patting myself on the back. I was nothing special. I just was kind and took time to answer their questions and to have real conversations with them.
I think the truth is because I can see it in your face, like, and meeting you, but also even watching your videos before I ever met you is the key ingredient, at least in my opinion, is that you care. Like,
Yeah,
you genuinely care, and just to kind of pull back the veil on healthcare as a whole, when you experience whether you're a patient or the family of the patient or you're the RT or the nurse or the physician, when you experience a healthcare worker who cares, right? Whether they're your educator or they're the one who's taking care of you or you're their coworker makes a complete difference. And I just want to touch real quick on the reality mostly that I hear about nursing because you don't hear so much about RT, but it's the same of burnout, right? Like you have these nurses who go to work who are on 12-hour shifts, are literally committed to their patients, are doing so much for them. And the patients, a lot of times now, you're hearing of violence within healthcare on healthcare workers. They're not being very nice to the nurse. They're saying these things, or it's like the physician or the RT or the other nurse. They're just
right.
excuse my language. They're assholes. They're not nice at all.
Yeah,
But when the person goes to a job where they also, I don't think, same as teachers, you don't get paid nearly enough for what you're
right.
actually doing, but they do it because they care, and there's
Yep.
something innately about that person that cares that just does a better job. They just do a better job.
Yeah,
So, is there anything that you can, like, speak on as being a person who I can see cares about the student, cares about the
yeah,
profession, cares about your patients, that for those people who may have gotten into healthcare, whether it be nursing or RT or, being a physician, that is in it for the money or is in it for the security of the job, because I have met those people and I don't know if you can teach care, but is there something you can say of like your life it might hurt you might, what I mean? Like it might hurt a little bit in the sense of when you care, but it's not, you're not shown all that gratitude, but yet you are able to keep your head higher because you know you're doing a better job.
yeah. I mean, I don't know. It's hard because I don't know if you can teach caring. To be honest with you, I really don't. You think about caring, you just have to care so much, and it's all right. I'm gonna go back to the shift for just a second. One of my biggest regrets, if I could go back and do the shift all over again, if we could relive that crazy 24 hours, the one thing I would make certain to do this time around is to say bye to you. Because you left and I never even got to say bye. I never could give you a hug and tell you how proud I was. But that's how much I care. Is like after that insane night and all the things that are coming out of it, it's like still if I could go back and do one thing different, it would be like, damn it, Danny snuck out without me I was busy. I was busy. But if I would have just slowed down a little bit to make sure I got to say thank you to you in person and give you, a little hug and just say thank you, because that's caring, is when you put everybody else's thoughts above your own. I will say this though. I think one element to people talk about burnout, and being tired and being burnout are not the same thing. So I've been tired a lot. I mean, I've been tired. I get tired, right? But other than that one time, I don't think I've ever truly been burnt out. I've been frustrated, exhausted, tired, never burnt out, because I love what I do. And the reason I love what I do is because I've jumped all in head first. It was that when I went through that phase and I came back and I was like, I want off trauma, I made a decision. I was like, you're not going to just go from trauma to med surg and just do the same thing. If you're going to be in respiratory therapy, then you're going to be all in respiratory therapy. And so it's that decision to invest in those around you, which we've already said, but also invest in yourself. You know, like AARC Congress is coming up. That should be on every RT's agenda to make a Congress within the next 2 to 3 years. It's crazy. There's 150, approximately 150 respiratory therapists in the country, 137. I don't know the exact number, but somewhere around there. And if just 10% came to Congress, that would be a 15,000 person event. There'll be approximately 4,000 people there, right? It's huge, but it's those type of things and the connections you make. And we touched on this at the shift, or during the shift, actually, episode 4 airing this Sunday. We're going to see the roundtable discussion. It was talked about there so many times. Like, you think about it, it's like, okay, how did Joe get Dana Evans and Brian Walsh and Kathy Henninger and Liz Santamaria and Teresa Grego? How did he get these people to come to this and do this? Connections, investing in the profession, going and meeting these people, talking to them, spending time getting to know them and building relationships that we don't talk every day. We don't even talk every week, but we talk routinely throughout the year. And it's that sense of accountability that happens without anybody saying anything. Like, I'm here in Texas and Liz is up north of Detroit and Kat's in Buffalo. But we all know that they expect my best, and we hold each other without ever saying a word to a level of accountability. And when we have those off days, you can just somehow know to just send a random text that just says, hey, go kill it today, guys, or whatever. And then you get that text back like, that's what I needed. I needed to hear that today, because man, it's been rough lately. And so, we talked about it. You have your family at your workplace, and that you're going to see them and work with them all the time. That's important. But there's got to be something bigger. There's got to be professional growth that extends beyond your own little personal space in your domain. And I really believe that is where career satisfaction comes from, is in investing and putting yourself into something that is bigger than yourself. And just the connections, the people. Oh my gosh, I can't tell you how much my world changed when I decided to go all in instead of being half in, just collecting a paycheck, doing my job, doing it really well too. I did it well, really making the decision to go, just go to a state conference, go to a national conference, go infuse yourself with other people from around the country and watch what happens. I promise you will not regret it.
Well, you hit on something that I think
Yeah.
surprised me going into school, going in clinicals. Now I'm working as techs at a couple different hospitals. And I didn't realize that relationships with your coworkers or your peers is a huge part of your life, your career. And it's great to hear you hit on it and talk on it. I will say I'm in like some respiratory therapy groups like on social media. And one of the things I hear a lot is like workplace bullying, like cliques, people who aren't that nice to work with, like nurses and RTs who just butt heads and the dynamic is like really ugly. I truly, truly believe if you are the person who cares and goes in not expecting to get something, right? But like
Right.
goes in wanting to give something and say, hey, you know what? I want to have your back today. Let's see how we can
Yeah.
team up and make the shift easier, this patient's easier, like your education easier. And I think so many people, and this goes way beyond healthcare, but in life, we're humans who are out for ourselves. Like it's, how can I eat? How can I be stable? How can I be happy? So on and so forth. But if you really
Yeah.
go into your environment, your relationships, your situations, your workplace as what could I give today? Like, how
Yeah.
could I help somebody today? How could I make this day better, not just for myself, but for someone else? You can change the whole dynamic of an entire department or workplace. So
100%.
I can see that you're like that person, which I think is why you have like amazing experiences, it sounds like, and you've built these amazing relationships. And I do just want to challenge anyone listening to this who might say, like, I don't have that experience, or I don't have great relationships, or people don't, I don't connect with them at
Yeah.
conferences. You do have to, I think, go in with a little bit more of a giving
Yeah.
mindset.
Yeah. So I'll tell you this. I'll try to make this quick, but I do have to share this with you because I think it's so cool. I remember the day. I remember where I was when this hit me. When I was like, wait a second, because you just said the magic word of everything is relationships. Like if you think about it, like if everybody was just to take 30 minutes and just think back and roadmap their life, it would come back to relationships. Like you go back to say, okay, well, when did I get in RT school? I got in it. I was started in 1999 and I got into it at Amarillo College. I lived 8 hours away from Amarillo. How did I get into Amarillo College? Why did I go to Amarillo College? Because I had a girlfriend who I went to meet her dad at that time, and guess what? He introduced me to a respiratory therapist that night, sitting there, and I said, "Okay, so that's how you got into respiratory." But well, hold on a second. Before that, I was at Texas A&M, and how did I get to Texas A&M? Because if I didn't go to Texas A&M, I never would have met the girlfriend. So it's my friends from second grade that we grew up together. I said, I'm going to go to A&M. I actually got a scholarship to go to UT. And because of my friendships, I said, no, I'm going to go to A&M with my friends. But then it goes even further than that. It's like, well, how did you meet your friends? And he's like, oh, well, it was a small town and I went to school and I just, one day, one of my friends came up and was like, hey, you want to be my friend? And I was like, yeah, I want to be your friend. And he was like, but if you're my friend, you got to be Scott's friend. And I was like, okay, I'll be Scott's friend too, And so you realize like, and then it gets weird if you go back much further than that, because then you're like, okay, my parents, before I was ever even born, it's their relationship, the reason I'm even here. And then go back to their parents being the reason they're even there. So you realize like everything in your life comes back to relationships. And what I like about this story the most is that when I think back and I roadmap that and I said, okay, why am I where I am today? And I go back and I say relationships. Then guess what? I now know how to get to where I want to go, relationships. And now I can intentionally build relationships that will, again, help augment my life through the key thing you said, building relationships off of mutual benefits. Like hey, I'm going to invest in you, and this relationship is going to help all of us grow together. So connecting with more people in more places, just have questions. You just have, I mean, me, the prime example, lady came over here to the office the other day and she was asking, she was like, hey, I can't remember what the question was. She was like, can you talk about like breathing techniques for like, I don't remember if it was mental health or something. And because she started asking about that, and I was like, well, in the hospital setting, in my training, we're really more focused on pulmonary disease management, right? Like we don't really, I didn't get any training on breathing techniques for like mental health and anxiety and things like that, right? What did I say to her? No, but I know who can, and I gave her your number.
Love
And
it.
so you realize that everything comes back to relationships and the people you know. And the more people you know, the more people you can help, because nobody has everything. Like I get questions all the time and I'm like, I don't know the answer to that question, but I know somebody who might. And then I can connect those people, It really does. And that's how I think the why when people talk about burnout, I say go to a conference. Go to a conference and meet some people, and that's hard for some people because they're like, "Oh, that makes me nervous." It just I promise it's the name of the game for career satisfaction is diving in and doing more, not less, whether you get paid for it or not. Well, I have to pay out of pocket. We'll pay out of pocket. I mean, like I know it's not easy, but if it's going to cost you $3,000 to go to Congress, then plan to save $100 a month for the next 3 years and go in 3 years. Like if you care enough and you want to find a way to do it, you'll find a way. And that's really what it all comes down to is finding that, that way again because you care and you see the value of. You have to go to get to really grasp the impact of this type of networking. Summer forum, phenomenal, phenomenal networking, phenomenal connections to be made. Congress, the same thing, just so many people, so much cool stuff. And you really, last year, I talked to a therapist or I saw a post, I think it was on Instagram. I saw a post, and the post said, just returning back from Congress, and my cup is completely overflowing. And this person was like, not overflowing when they went. They were kind of down, kind of like frustrated with where they were in their career, and then they go, and it's just magical how little things happen that you leave feeling fulfilled and uplifted. But you got to go. I mean, I wasted half my career before I really started getting involved like I should have. So what I would say to any student or new grad, uh, don't waste time. Like, jump out and find a way to get involved, find a way to lead the change, to be the change.
I love that, and I think too, just to echo that in a microcosm would be like, go outside of your department, go talk to the nurses, go you know what I did, the other day was I was in the cafeteria and, it's lunchtime, everybody's going through, everybody only has a little bit of time, they gotta get back to the case or the patient or the department, whatever, and I looked up at the cashier who's in the cafeteria and I said, "Hey, how's your day going?" And
Yeah,
she looked at me like somebody's talking to
yeah,
me, and then
yeah,
we sat there and talked for 15 minutes, and then one of
yep,
the cooks came over, and we're having a great conversation, and, we're all aging as women, so that's where the conversation went of, like, how to navigate that, but I mean, I had this amazing connection with these ladies just by taking a moment to invest in them, right? So you're investing in people, you're investing to really care, like, how is your day going? Like,
that's
what's
right.
going on? Is there anything I can do for you if you're the nurse that I have 2 more minutes in your department before I go walk back? So, I just wanna say that I hear that, I hope other people hear that. I think there's little ways you can do it, there's the amazing ways that are gonna change your career that being on the shift for me, I feel has already been one of those, just applying to your show, you know? And I'd like to wrap this conversation up because I wanna be mindful of time, but I wanna wrap it up in the sense that my podcast is called Breathe or Die. I teach breathing techniques. I try to educate people how to create a relationship with their breath, to talk to it, to listen to it, to use it as not just a tool of communication, but a tool of optimization and, just connection in all different types of
Right.
ways. If there's one thing and all the things that you know about breath, if there's one thing about breath that you want people to know, what would that be?
Oh wow, what a question! Didn't see this one coming. About breath, I don't know. I think it goes back for me. It just goes back to where I opened at. It literally is the most organic thing you will do during any given day. And maybe just take time to be thankful for it that you don't have to think about it. Maybe just that. Just when you're giving thanks and praises for all the goodness in your life, just maybe today I didn't have to think about breathing. That in itself is a good day because people out there are having much, much worse days than that are trying to wonder if there's going to be another breath or not. Um, and so I think just the organic element of it, but it's important. It's the name of your podcast, breathe or die. You got two options: breathe or not. And if you don't, then you're not. So it's just so beautiful. It's the first thing you do when you're born and the last thing you do before you die. And so I stole that from Miss Teresa Griego. That's her saying, but it's so true is that, you know, between the first and the last breath that you will ever take, there's so many breaths that you'll never think about. And maybe we should just be thankful of that sometimes. And when you can't breathe, just know hopefully there'll be a respiratory therapist nearby that can help.
Hopefully. Hopefully, you'll know them by name and you'll say,
That's
"Hey,
right.
buddy, how you doing?"
That's right. That's right.
Joe,
That
thank
is right.
you so much. Like, I feel like I could, go through a whole 'nother hour and a half talking with you
Yeah.
and asking you so many different questions, so maybe we'll do a follow-up.
Yeah.
Is there a way? Because you have some great education out there, not just the shift, but on your YouTube channel, on your
Yeah.
website. Can you tell people where to find you?
Yeah, so, on all the socials at Respiratory Coach, YouTube at Respiratory Coach if you're looking for free short tutorials trying to get you through school. I don't even know how many videos there are now, but there's a lot. And then the website is respiratorycoach.com. And you can even contact me through there. There's a contact form, or you can always send me an email at joe@respiratorycoach.com.
And I
And
know
I
you have
love interacting with people, so
and
send
you
it
have some
away.
awesome freebies, so if you are an RT student, and you need some cheat sheets, he's got some awesome free resources that I have been using on his website, so
Okay.
you go and check it out. I'll put it in the link below. Thank you so much again, and, I'm sure we'll talk soon.
Yeah, 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 for sure. I'd love a follow-up, and I am so proud of you. Keep doing the strong work. You're amazing to watch on the shift, and, I'm enjoying every minute of it, and so just keep up the strong work on your end also.
Yay,
And
thank
tell
you.
Kevin I said hi.
I will.
All right.